Hello, everyone, and thank you for joining us for this presentation on the Kansas Health Equity and Outcomes Coalition, led by the Kansas Council on Developmental Disabilities in collaboration with Dr. Gaffney from Advent Health. We're excited to share what we've been working on with you today, but I think we're going to start with some quick introductions from the team.
Thank you, Allison. Thank you again for joining us. I am Sarah Hart-Weir. I am the Executive Director of the Kansas Council on Developmental Disabilities, and I'm going to turn it over and let our team here introduce themselves.
Hi, my name is Whit Downing, and I am the Behavioral Health Program Coordinator for KCDD and a self-advocate.
I am Laura Gaffney, physician, and the Medical Director and founder of SPAN, the Special Pediatric to Adult Need Program Primary Care Clinic at Advent Health, and the co-chair of the IDD Council.
Hi, I'm Lola Cornell. I am the advocacy coordinator for KCDD as well as a self-advocate.
Hello, my name is Allison McCain. I'm the Health Equity Director with the Kansas Council on Developmental Disabilities, and I am the co-chair of this Health Equity and Outcomes Coalition.
Before we get started, we just wanted to take a quick moment for everyone participating in this important annual meeting to talk about the mission of our Kansas Council on Developmental Disabilities. Like all states, we are the dedicated DD Council to the state of Kansas. As you can see here, our mission is to empower individuals with intellectual and developmental disabilities, as well as family members and caregivers, to lead transformative systems change across the state of Kansas. We work to build capacity within our IDD community, as well as advocate for inclusive, integrated, accessible communities where everyone belongs and thrives in the state of Kansas. You can also see on the screen here our vision and our purpose and the work that we do day in and day out to execute on our 5-year plan in the state of Kansas. And again, one other thing that we wanted to point out as our team goes through this presentation and talks about the important work that our coalition is doing across the state is that we were very honored a couple of years ago to receive a generous grant from the Administration on Community Living, specifically the Public Health Workforce Grant under the Biden administration, to support transforming our public health infrastructure and workforce in the state of Kansas to truly address the equity and accessibility of individuals with IDD across the state. And so the grant that we received was dedicated to getting this coalition off the ground and making sure, under Allison McCain's leadership, this becomes a sustainable effort where the voice of our community is included in all of our healthcare systems, our public health infrastructure, and we're working alongside our state agency partners across the state of Kansas to meet more of the needs of our IDD community in the Sunflower State.
Advent Health Medical Group Primary Care and Shawnee Mission, Kansas, is providing comprehensive patient-focused care for adults with chronic conditions through the Special Pediatric to Adult Need program that I founded. It is currently the first and only program of its kind in Greater Kansas City, and to my knowledge, one of only a few programs in the nation that provides primary care for any special need, which may include Down syndrome, autism, cerebral palsy, and genetic disorders. The primary care clinic of SPAN allows patients and families to provide primary care in the same location as their family members, regardless of their diagnosis. The supports we have include a nurse practitioner, a social worker, and other clinical associates who make up a patient-focused team with expertise in the care of adults with special needs.
In the fall of 2023, the Kansas Council on Developmental Disabilities, in partnership with Dr. Laura Gaffney, launched the first of its kind Intellectual and Developmental Disabilities Health Equity and Outcomes Coalition, with the goal of bringing together self-advocates, families, caregivers, as well as our Kansas state agencies, including the Kansas Department of Aging and Disability Services and the Kansas Department for Health and Environment Services, healthcare professionals, researchers, and providers from across the state. With this coalition, through a series of 4 different work groups, we have been working on developing an action-oriented blueprint to address some of the barriers we're seeing in the healthcare space for individuals with IDD and their families. We hope to ensure the healthcare systems and partners throughout Kansas realize health equity in urban, rural, and suburban communities. This platform of stakeholder engagement has been seeking to address and improve the quality of life and increase life expectancy of all Kansans with IDD, address issues related to access, improving medical care access, expertise, and training across healthcare professionals, to address some of the access issues that we're seeing in our rural Kansas, and supports and services, disability-related benefits across Kansas, address disparities in health and healthcare delivery across our state for the entire IDD population, and enhance the workforce that works so closely with our IDD population, including direct support providers, healthcare professionals, and their caregivers. As we began to develop the coalition, Dr. Gaffney and I met with stakeholders individually to learn more about their work goals and needs. We created 4 work groups that aligned with the concerns of stakeholders, including improving overall health across the lifespan or pediatric to adult clinical care, increasing research participation, innovation, and outcomes, or as we call it, inclusive research, expanding resources for our aging population and their caregivers, and increasing diagnosis, treatments, and supports for co-occurring behavioral mental health conditions and IDD. Here you can see the framework of the coalition and how we broke up into work groups that aligned with the 4 goals, as I stated previously on the last slide. Each group meets on a monthly basis to collaborate, identify gaps, progress, and opportunities within their scope of work, and develop a strategy, whether that be an outreach strategy, development of materials, programmatic support, and/or a policy strategy to address the desired outcomes. Here you can see a quick list of organizations that participate in the coalition. Many of these organizations lead with IDD, while others are new to the table, but may serve the IDD population in some capacity, whether that's the Kansas City Hospice and Palliative Care, the National Alliance on Mental Illness Kansas, or NAMI Kansas, or the Kansas State Nurses Association. We also have members from underrepresented communities in Kansas, including the Kansas City Indian Center, Black Nurses Association of Kansas, the Community Health Council of Wyandotte County, and our community developmental disability organizations in Western and rural Kansas.
The Pediatric to Adult Clinical Care Work Group is trying to address barriers to accessing healthcare, and we have several different goals. We want to improve care coordination for self-advocates, families, and caregivers. We want to assist in the transition from the pediatric to adult clinical care and helping patients navigate health insurance systems and health care systems. We're trying to standardize medical forms. For example, there are over 20 different forms that are used for physicals in the state of Kansas. And we are trying to simplify the forms and yet improve the ability for people to access care by using those forms. We are trying to address lack of primary care physicians who take Medicaid, as well as the specialists who take Medicaid, and trying to address how people can access healthcare across the state. And we're helping to coordinate clinical care institutions, regardless of the community, whether that's suburban, urban, rural, or academic. And we are focusing on a heightened awareness of women's health, including mammograms, cancer screenings, regular OBGYN care, with a women's health guide in plain language to be published this fall.
I have been working on creating a women's health guide that is accessible for all women with IDD. This guide includes information on healthcare, nutrition, reproductive health, cancer screenings, and more. We have many co-authors, including myself, and women from the Girls' Night Out, neurodiverse women's group, and healthcare providers. This is important because studies show that women with disabilities are less likely to receive pap smears, as low as 66.1%, compared with non-disabled women, 81.4%. Disabled women were also much less likely to have a mammogram, as low as 61.2%, when compared with non-disabled women, 72.8%. It is important for women with IDD to understand our options when it comes to cancer screenings and prevention methods. Women with disabilities are more likely to be diagnosed with breast cancer at later stages and have higher breast cancer mortality rates compared with our non-disabled peers.
In the inclusive research work group, some of the barriers that we are seeking to address and goals for the work group ensure disability is included in DEI policies and strategies in healthcare and research. We're bringing together research institutions across Kansas, whether that's KU or the Children's Mercy Research Center, to really collaborate and work together on increasing research in our IDD population. We're also building a pipeline for people with IDD to have a seat at the table through all parts of the research process as co-researchers, in collaboration with KU's K-Heart program, which skills up individuals with IDDs who become co-researchers, which WIT has been a part of. We're working on building a pipeline so that they can enter into the co-researcher space after they graduate from the K-Heart program, whether that's at Children's Mercy Research or in one of the KU institutions. We're also working to increase research participation across all IDD diagnosis, and we're going to be creating a newsletter that healthcare providers can give to their patients that'll give a quick info on what to expect when participating in research, and that's going to be in plain language, as well as a link to participate in the Down Syndrome Connect or Autism Registry or other research opportunities in the state of Kansas. In our behavioral health work group, we have brought together stakeholders to increase access to behavioral health services for our IDD community in Kansas, working with our state partners, KDADS and KDHE, to improve the quality of care in mental health and behavioral health services. We want to ensure that our mental health providers in Kansas feel that they are equipped and trained to serve our IDD population. We've also been working with KDADS in the 988 crisis hotline training, so that there can be an easier way for callers with IDD to get direct support for someone who's trained in taking their calls. We're also developing, with the help of WIT Downing, a set of IDD behavioral health, mental health toolkits, and including nonverbal training materials, which WIT will go into a little bit later. And then we're going to be increasing mental health supports for individuals with IDD, as well as supporting the healthcare providers, ensuring that they have the proper training and workforce to care for our co-occurring population.
Allison mentioned 988. 988 is a number that people can call, text, or chat with when they're experiencing thoughts of suicide or a mental health crisis. Experiencing thoughts of suicide or even just struggling with your emotions can be really scary, and calling the 988 lifeline number can also be scary. So that's why I made this plain language guide. This guide is a resource for everyone, but specifically for those of us with IDD. I want people to know what to expect when calling 988. So this guide not only goes over what happens when a person calls, like dialing the number, waiting for a counselor, starting the conversation, having the conversation, and ending the call, but it also goes over a few frequently asked questions and answers. It's very important it's really important to include people like myself who have IDD when you're having the conversation about mental health and suicide prevention. So that's another reason I made this guide. So I wrote a guide about what a safety plan is and what you should include in a safety plan. I wrote it because I know how important it is to have a plan in place should an emotional or suicidal crisis occur. Even if a person has never had a suicidal thought, it's still important to have a safety plan because it doesn't mean that you're anticipating it happening. It means that should it happen, you will be more prepared. Safety plans should include warning signs, coping skills, people you can reach out to, and really, most importantly, a person's reasons to stay alive. I created this plan in plain language so that people with IDD can better understand what a safety plan is, how to use it, and how to make one.
And last but not least, our final work group is the aging and caregiving crisis. In this work group, we brought together parents with lived experience, self-advocates, and providers to enhance resources for caregivers and guardians as they navigate the system, especially the transition period. We also have been working on opportunities for aging in place, equity in retirement, and new housing solutions for our aging IDD population. We're also working on increasing capacity, flexibility in the IDD workforce, whether that's a DSP training program or a new legislation that can help with rate parity for our direct support providers, and how to support family caregivers, whether that's paid family caregiving or increased supports as they can bring their individual or loved one to day center, and then the ability to meet the IDD community where they are and where they need healthcare, live, and work, whether that's in-home care, supporting our dementia, Alzheimer's, and IDD population, supporting hospice and palliative care training, and then residential care for individuals who require 24/7 care. And that's all we have for you today. So thank you so much for watching.